Hi, this is Dr. Nick. I'm the incrementalist here with incremental insights for better business, better health.
And I'm Fred Goldstein with Accountable Health here, helping employers for their employee health improvement programs, as well as working through the current COVID pandemic. So, Nick, we really didn't want to have to get into this again, but once again, Delta is just out there and taking over regions of the country. So, what do we need to be considering now with this?
Yeah, I really didn't want to. I was trying to find something else, and you and I both talked about this a lot to see if there was something else that we could talk about. But it is Delta, 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 and it's a rising incidence of this particular variant that is highly transmissible. It's running through our communities, individuals like a dose of salt. To be clear, it is the folks that are unvaccinated, the majority of which there are a few of the individuals, very small minority of people that have been vaccinated who still got Delta. And we are just creating more opportunities for challenges down the road because we essentially will find ourselves with another variant that is going to cause more problems. And I think importantly, we're impacting the people that just got wiped out. Let's be clear, wiped out with work and overwhelming dealing of patients coming in high risk circumstances with ventilation, aerosolization of this virus, and we're asking them to do it all over again. That seems really challenging to me.
Yeah, so the healthcare workers obviously are fairly frustrated, as I've heard and we've seen from expressions around the country, and rightfully so. And to give you just a sense of this, it obviously is some regional variation. The four counties here around Jacksonville are four of the top five in the nation for the rate of infection per 100,000.
Yeah, for those of you watching on TV, what you can't see is the big bubble that's around Fred because he's living in that world. It's just truly shocking. And you know, what do you do about it? Well, we know what the primary answer is: get vaccinated. I saw something just very recently that said we've seen an uptick in the number of new vaccinations. There's a lot of programs attempting to get to that. And we're also seeing the return of masking and NPIs as we reference them. And of course, you know, some resistance. I've heard that repeatedly. Well, I've been vaccinated. Why should I? What is the purpose? What is the incentive to get vaccinated if we all have to mask up again? And, you know, I recognize and understand that, but the reality is that we're doing it for our fellow citizens. We're doing it for the healthcare workers and all of the people that work in the healthcare system. And we're doing it because we want to suppress this virus sufficiently so that the R value drops below 1 so that we see a decline, we see a reducing instance, and therefore this virus doesn't have the opportunity to develop a new variant and causes even more problems.
Right. Absolutely. And just a quick point on that, the hospitalization rate in Jacksonville is now 150% of the highest point it ever reached any time prior in the pandemic. So it's clearly impacting healthcare workers inappropriately, and we really need to think about that. So let's pivot a little bit, Nick. One of the things that occurred during the COVID pandemic was the recognition that people couldn't go in to see their physician. So lo and behold, telehealth explodes. Rightfully so, and all of the systems start to put this in, and we're now seeing it level out. But it's leveling out at a fairly substantial rate. I think it's about 38 times higher than it was at prior to COVID. So people are continuing to use this. But what should employers, healthcare systems, and others consider as they look to put this type of service in?
Well, first of all, ask the question, would you like to have access to telehealth? I know I would. I did before COVID-19. I always thought that this was an extraordinarily valuable opportunity to engage with people, not to have to get in the car, park up, go in to an office, sit in the waiting room for all these times. So, you know, huge potential, but you really want to have this built into your programs. I think your employees are going to insist on it. But from a clinical standpoint and from an organizational standpoint, you want to make sure this is integrated into the rest of care. telehealth does not replace everything. I mean, there are things that we cannot do through these interactions. They're fantastic for certain things, but it needs to be part. So if I was to dream, it would be it's no longer telehealth, it's just healthcare delivery, and how it's delivered and which channel is used doesn't matter. From an employer's perspective, make sure that that's incorporated in so that you have those solutions seamlessly integrated into the offerings and they're affordable and the people delivering the care get appropriately compensated for it.
Absolutely. And I think by integration, it's sort of taking it down that next level. They need to recognize that typically this has been a bolt-on service, often provided by a third party. And is it actually integrated with the electronic health record that the primary care physician or other specialists are using so that they data can seamlessly transfer when someone does a telehealth visit that might not be with their normal physician. Oftentimes practices are putting this in, and for example at Mayo I recently had a telehealth visit and it was great. It was with the physician at Mayo who I'm seeing, but that data needs to then get around to the others, and so ensuring that that's connected, asking your provider as an employer if your system is set up that way, and also making sure that it's meeting the needs of your individuals, of your employees. We're seeing a lot of use of behavioral health in this space, a critical area, which is fantastic to see. This may be one of the key solutions to allow for some anonymity, that I haven't parked my car outside the psychiatrist's office at the same time.
Yeah, but, and here's something else for employers to think about. In that particular instance, for some folks, the privacy in their own home setting can be a challenge. And we've heard stories of people actually carrying out these interactions, not just from a brain health and other areas, but doing so in the car because that's the only place that they have privacy. So thinking about that and making sure that people have access to the right resources. And I'm not sure what the answer to that is, but as an employer, if you thought about that and started to offer some solutions for your employees and the people that are working for you, I think, we talk about mother and baby rooms in offices. And I know we're not going back to the offices, but, that was a response to a circumstance for lactating mothers. Maybe there's another solution around telehealth that we can provide some privacy for our employees. Maybe it's that they go to the local office. It's not used for anything else, but they can use it for a telehealth consult. What an idea.
Absolutely, a great point. You need to look at the privacy on both sides of that equation, where the individual is, as well as making sure it provides a safe environment for them to talk about it. So once again, another fantastic week, Nick. It's been great speaking with you, and hopefully at some point we can move beyond Delta. This is Fred Goldstein with Accountable Health. If you'd like more information, please reach out to accountablehealth.com.
And this is Dr. Nick. I'm the incrementalist here with incremental insights for better business, better health.